Sometimes you can't even see them.
The nurses?
Yeah.
This senior healthcare assistant looks after patients with dementia on a ward often short of nurses.
The phones are ringing, nobody is answering it. And some patients roaming the wards, they are left to fend for themselves.
And does it worry you to be put in that position of working unsupervised?
Yes, it does. It does.
It sounds very frightening.
Yeah, it is. It's dangerous.
And it's far from unique, it seems. Surveyed by their union, 51% of healthcare assistants reported doing tasks like giving medication, taking a blood sample and carrying out an ECG without proper training. 9% said they did this every day. 63% also said they worked without adequate supervision. 27% reporting that happened daily.
It is becoming dangerous. There could be fatalities. We've had incidents of staff getting seriously injured.
Staff being attacked by aggressive patients?
Yes, yes.
When asked if they'd picked up extra work specifically to cover nurse shortages, 74% of healthcare assistants said they had, with 57% who could compare to last year reporting it's happened more often this winter.
What we really need to see is some action and focus on filling those vacancies, on looking again at how we support people to qualify as nurses and how we train and support healthcare assistants who want to do that job but to do it well.
Laura's a senior healthcare assistant at Southend University Hospital and appreciates getting proper training and supervision.
So you've learnt about something, you've written an essay about something, but then suddenly you're there with a patient and you've got to do it. And it's important to have your colleagues around you to say, yep, you're doing this right. You're actually putting it into practice. All right, can you reach that okay?
Lovely.
And anything else I can do for you?
With the hospital's help, Laura has just started training to be a nurse. But nationally, 77% of healthcare assistants who want to do that say they weren't offered enough support or opportunity to fulfil their ambition. A short-sighted approach, as it's one of the key ways to solving the NHS nursing shortage.
It's really important. It's a very intrinsic part of our workforce planning. We need to be looking at actually the support staff we've got, establishing what they want to do, what their ambitions are, but also what their capabilities are, so that we can have our existing workforce, as in healthcare support workers, filling some of those gaps in the future.
Yet many healthcare assistants are currently having to fill those gaps without proper training or supervision, living with the worry of taking the blame if they make a mistake.
My greatest fear is that something serious might happen and you get criminalized for it. It's easy to make the healthcare workers scapegoats when things go wrong.